prevalence of about Gigantism and Acromegaly mutation. Definition. Clinically relevant pituitary adenomas have a prevalence of about 1 per thousand in the general population and are an important cause of morbidity due to the combined impact of hormonal dysfunction and tumoral mass effects. About 4% of cases occur in an entirety of family settings. Some these form on component and multi-site tumor syndromes like multiple endocrine neoplasm, types 1 and 4, and chronic complex among others.
Acromegaly. Acromegaly occurs whenever there is excess growth hormone in the body. That excess growth hormone causes abnormal skeletal growth. Acromegaly occurs after epiphyseal closure. Because epiphyses have fused, so linear growth cannot take place. So broadening of skeleton occurs. Hands get big. Foot size increases. Patients usually complain that their rings don't fit them anymore or their shoes have gotten too tight. There is excess growth of jaw resulting in macrognathia. And if excess growth hormone secretion occurs before epiphyseal closure, so epiphyses can grow and there can be linear growth, and that linear growth causes people to get too tall, and that is not called acromegaly. Then it is called gigantism. It is called gigantism if there is excess growth hormone before epiphyseal closure that makes them too tall. Acromegaly also causes sleep apnea because excess growth hormone causes proliferation and growth of tongue. Enlarged tongue, that enlarged tongue fall back onto their throat during sleep and causes obstructive sleep apnea. It also causes joint pain because it causes excess proliferation of the cartilages in joints, and that excess proliferation of cartilages causes joints pain. And it also causes
Clinically relevant gigantism and acromegaly dual applications in medicine. Alternatively, pituitary adenomas can occur alone in a family settings as part of familial insulated pituitary adenoma. Up to 20% of key breasts have germinally mutation of the early hydrocarbon receptor interacting protein gene. Rare cause of FIFA can also be caused by Xq26 microduplication that include the gene GPR101. Mutations lead to pituitary adenomas that have a distinctive clinical profile with a significantly younger onset, more aggressive tumor growth and larger tumor diameter to diagnosis and compared with non-IP-associated pituitary tumors. Etiology. It is caused by pituitary gland overproducing growth hormone GH. Over time, the pituitary gland and small glands situated at the base of the brain behind the branch of mouth produce a number of hormones. GH plays an important role in managing cycle growth. When GH is secreted in the bloodstream, it triggers your liver to produce a hormone called insulin-like growth factor. In turn, stimulates the growth of bone and other tissues.
Gigantism. Gigantism is a rare condition characterized by exaggerated bone growth and an abnormal increase in height, significantly above average. This condition occurs in childhood before the fusion of the bone's growth plate, which is usually seen at some point after puberty. The growth plate is the area of active, soft-growing tissues near the ends of the long bones in children and adolescents. Adults do not have growth plates. Most long bones have two growth plates, one at each end. They are found in many places, including the thigh, hand, and forearm. During adolescence, when growth is complete, the growth plates harden into solid bones. This happens around age 13 to 15 in girls and age 15 to 17 in boys. For people with gigantism, there is excessive growth during childhood before the growth plate closes or hardens. Gigantism should not be confused with acromegaly, the adult form of the condition, marked by an increase in bone size, including those of the hand, feet, and face. Causes. The most common cause of gigantism is a benign pituitary gland tumor. The pituitary gland is a small gland located at the base of the brain behind the bridge of the nose. The pituitary gland makes the hormones that control so many functions in the body, including growth, metabolism, temperature, urine production, and sexual development. A tumor on the pituitary gland causes it to produce excess growth hormone than the body needs. This subsequently leads to abnormal growth of soft tissues and skeleton. Other less common causes of gigantism include
Does your child seem much shorter or much taller than other kids his or her age? It could be normal. Some children may be small for their age but still be developing normally. Some children are short or tall because their parents are. But some children have growth disorders. Growth disorders are problems that prevent children from developing normal height, weight, sexual maturity or other features. Very slow or very fast growth can sometimes signal a gland problem or disease. The pituitary gland makes growth hormone, which stimulates the growth of bone and other tissues. Children who have too little of it may be very short. Treatment with growth hormone can stimulate growth. People can also have too much growth hormone. Usually the cause is a pituitary gland tumor, which is not cancer. Too much growth hormone can cause gigantism in children, where their bones and their body grow too much. In adults, it can cause acromegaly, which makes the hands, feet and face larger than normal. Possible treatments include surgery to remove the tumor, medicines, and radiation therapy.
neurofibromatosis.
Etiology. Applications in medicine. Diagnosis. Level of GH and IGF-I elevate levels of these hormones, suggests acromegaly, growth hormone suppressing test. This is a definitive method of verifying acromegaly. In test, blood level GH are measured before and after renal preparation of sugar. Normally glucose ingestion depresses level of GH. In half acromegaly, GH level will tend to stay.
Gigantism, also known as giantism, is a condition characterized by excessive growth and height significantly above average. In humans, this condition is caused by overproduction of growth hormone in childhood, resulting in people between 7 feet (2.13 meters) and 9 feet (2.75 meters) in height. The term is typically applied to those whose height is not just in the upper 1% of the population, but several standard deviations above mean for persons of the same sex, age, and ethnic ancestry. The term is seldom applied to those who are simply tall or above average, whose heights appear to be the healthy result of normal genetics and nutrition. Gigantism is usually caused by a tumor on the pituitary gland of the brain. It causes growth of the hands, face, and feet. In some cases the condition can be passed on genetically through a mutated gene. Other names somewhat obsolete for this pathology are hypersoma, Greek, hyper over the normal level, Soma body and somatomegaly, Greek. Soma body, genitive somatos of the body. Megas, general megalugrate. In the past, while many of them were social outcasts because of their height, some, usually unintentionally, found employment in Friedrich Wilhelm I's famous Potsdam Giants Regiment. Many of those who have been identified with gigantism have suffered from
Symptoms. Acromegaly may produce the following signs of symptoms, which can vary from the person to another. Elegant palms of feet, consummate elegant facial picture, causes oil, pinkness, skin excessive sweating, body hair, small outgrowth of skin tissue, skin tax. Treatments. Surgery it can remove most pituitary tumors using a method called transsphenoidal surgery. Medications. Drugs that reduce excess growth hormone secretion. Somatic analogs. Drugs to lower hormone levels like dopamine and dopamine. Drugs to block the action of GH, growth hormone antagonists.
Hi, this is Tom from ZeroToFinals.com. In this video I'm going to be going through acromegaly, and you can find written notes on this topic at ZeroToFinals.com/acromegaly or in the endocrinology section of the Zero to Finals medicine book. So let's jump straight in. Acromegaly is the clinical manifestation of excessive growth hormone, or GH. Now, growth hormone is produced by the anterior pituitary gland. The most common cause of unregulated growth hormone is a pituitary adenoma, so a hormone-secreting tumour of that pituitary gland. And this adenoma might be microscopic, so small that you can't see it on a scan, or it can be significantly sized so that it causes compression of the local structures. Rarely, acromegaly can also be secondary to a cancer, like a lung or a pancreatic cancer, that secretes either ectopic growth hormone releasing hormone, or GHRH, or ectopic growth hormone.
Pro and cons. Somatic growth is orchestrated by complex hormonal crosstalk involving the hypothalamus, pituitary, and perical tubes. Genetic disorders that affect this network can lead increased secretion to growth hormone, which result acromegaly. In the sex, the growth hormone occur before epiphyseal fusion to result on the gigantism. No syndromic gigantism is the most frequently caused by pituitary adenomas, occurring as a familial insulated pituitary adenoma, or sporadically, usually as a result of mutation in the gene encoding hydrocarbon receptor interaction protein. Issue applied in Ecuador. Acromegaly is a consequence of chronic growth hormone excess, due in the majority of cases to GH circuiting pituitary adenoma, and occurring with a population prevalence of 60 per million and incidence of 3 or 4 per million per year. Males and females appear to equality affected in the average age of presentation of 44 years. Younger patients might have more aggressive tumor and higher GH concentration. Conclusion. We describe a pediatric disorder, which we have X-like acromegaly that is caused by Xq26 genomic duplication has characterized by early onset pediatrics resulting from excess of growth hormone. Duplication of GPR101 probably causes GX-LEA. We also found a replay mutation andGPR101 in some